Good afternoon, everyone, and welcome to the 29th edition of Let's Talk Health by Star Hospitals. Today, we're going to be focusing on trauma, and more specifically, we're going to be focusing on neurosurgical emergencies associated with trauma. And to talk about this, my name is Dr. Rahul Katta. I'm the group lead for emergency services at Star Hospital. And we also have our senior neurosurgical consultant. Do you want to introduce yourself?
Yeah, good morning, everyone. I'm Dr. Vishwak Sena Reddy. I'm consultant neurosurgeon, Star Hospitals.
As a part of this entire exercise, particularly when we're talking about trauma, trauma that has long-standing consequences is neurosurgical trauma. Any injury to the head, any injury to the spine has long-standing consequences to the patient. Not just whether they would survive or not, which is mortality, but even the quality of life is affected as a consequence of such injuries. As a result, addressing it quickly and doing the right interventions at the right time makes a phenomenal difference with respect to the outcomes. And that is the reason why we are talking about this and why it is so important to address this critical need. And to talk about this, let's first talk about the different kinds of trauma that we might see in case of neurosurgical emergencies. So would you want to tell us what are the different kinds of trauma that you would normally see?
The most routine trauma we see are related to road traffic accidents. And the next common things are the domestic accidents, which we see like people come with complaints of like history of falls at home while they're playing or in the bathrooms or in the washrooms. And these scenarios comprise most of the trauma to us. The next important things are industrial accidents, or we of late we have been seeing a lot of construction work going around, and even in these areas we see a lot of like they come with history of falls or some machinery related injuries, or most of the things it is the road traffic accidents which would lead to the trauma. So for us it is important that we understand that how the mechanism of trauma is. That is more important for us to assess what exactly are the things which are involved, what systems are involved, and probably it also depends on the mechanism of trauma. That's the most important thing for us to initially assess what all is going on with the patient.
And that's very true. And as Sir said, a big chunk of the trauma cases which are causing significant challenges is road traffic accidents. We already know this. And that is the exact reason why prevention is always better. So always remember, whenever you're traveling on the road, particularly if you're on a bike, please wear a helmet. If you're in a construction zone and you're spending significant amount of time there, please make sure you have protective gear in place and you always wear a helmet irrespective of the amount of time you're spending on a construction zone. It makes a phenomenal difference. So always, please remember, safety always comes first. And as always, buckle up whenever you're using a car. And to focus more on neurosurgical trauma here, the different kinds of injuries we see as a consequence of such trauma is particularly focused. What we are going to focus on during this talk is with respect to head injuries as well as spinal injuries. Could we talk more about the kind of injury profile that you would normally see? Let's focus on neurosurgical trauma with road traffic accidents itself.
Yeah.
So what kind of injuries do you see associated with the brain?
Yeah. So most of the times what happens is the scenarios are different. You see, what happens is it depends on the mechanism of trauma.
Yes.
Today, for example, today we have seen one patient. She was traveling with her husband, and the husband was driving. They were trying to negotiate a turn, and they lost control of the vehicle. And then she was not wearing the seatbelt. She was sitting on the side, and then she hit her head. She was unconscious for some time, and followed by a big swelling over the face, and she was not able to see from left eye. So it again depends on the mechanism of trauma. So that is the most important thing.
Yes.
So how the accident happened, how the patient fell, or where they were sitting, where exactly was the patient sitting, did the vehicle topple, or such sort of things, especially four-wheelers.
Yes.
In terms of four-wheelers, most of the times, whether they are wearing a helmet and how they have fell down, the mechanism of injury, Because the other day we were seeing a patient who had a fall from the flyover, like they skid and the guy hit the safe railing, and then he fell from there.
Okay.
So many a times it is very important that we assess, and most of the times if somebody is able to witness it and they are giving us the history, that is very important for us in initially assessing what exactly are we dealing with, because in trauma it doesn't always specify that it is only the brain injury or the spine injury.
Yes.
You can have an injury elsewhere.
Yes.
So it is very important that we assess, we at least come to know what is the mode of injury.
Yes.
For suppose if the patient mechanism of injury is unknown, it's an unwitnessed accident.
Yes.
What happens in those circumstances is, like, if the patient is conscious, he's able to narrate the incident, then we can again assess. While we are assessing the patient, we can ask the history same time, or else what we need to see is, if somebody like the patient is unconscious, then we have to presume that the patient must have suffered with a head injury unless otherwise proved.
Yes.
So, and at the same time, we should also understand that at any trauma, if the patient is unconscious, if the patient, whether he's conscious, he's able to tell, and we should also consider the spine injuries especially.
Yes.
So in spine injuries, if the patient is conscious, most of the times they would give us the complaint that they have a pain or they're unable to move their limbs, whether the upper limbs or the lower limbs. If the patient is unconscious, until otherwise proved, we have to consider that the patient must be having a spine injury. We have to do a primary survey, and then we have to give a clearance for us to see that there is no spine injury in those cases. So it is also important that we need to ask the patient, and the important signs, especially when we have seen the patient, is we need to ask them whether they have was there any loss of consciousness, was the patient having any vomitings, or did the patient throw a fit, or was there any ear, nose, or throat or oral bleeding.
Yes.
All these things again signify the head injury.
Yes.
Another important thing is the pain, the spine pain, the neck pain, the chest pain, or the back pain. And they would also give us history related to the numbness or weakness in the legs. They are unable to move it. So all these symptoms at the initial time of assessment are very important for us to understand what exactly are we dealing with. At the same time, it is never specific that it is only brain or chest or the spine injury. We should always consider that what we should verify all these systems, whether it is chest, abdomen, the limbs, all these things have to be checked comprehensively.
Yes, that's a very important point that is made here. Remember this. In fact, we have reiterated this even during the previous discussions whenever we are talking about trauma. Most often than not, most of our audience are people who are not normally in the medical field. And this is why I'm going to give you a very simplified version of what you need to do whenever you're dealing with any sort of accident. So there are three things that you would need to do. Step one is always immobilize the patient. Do not unnecessarily move that patient unless it's absolutely required. And if it's a safety issue and you have to move that patient, make sure you immobilize them. What I mean by that is you make as much effort as possible to not move their entire spine, starting from the neck all the way down to the lower back. So step one is always immobilization. Step two is, if there's any significant bleeding from anywhere, try to apply pressure and try controlling this bleeding. Okay, that is all you would need to do at that point of time. And step three, as always, call for help, and call for help early. So make sure you're aware of the emergency number that is available in your locality. So for anyone who's close to Star Hospital, the number is 9071 104 108. So call for help early so that you have medical personnel who are deployed, who are able to attend to you at the site of the accident itself. So this is extremely crucial, and this is what's in your hands. Immobilization, control bleeding, and call for help is what each and every one of you can do, and it makes a phenomenal difference to their outcome. Because remember this, some of these injuries, particularly spinal injuries, if they do have a fracture and you're not careful about immobilizing them, then you can cause injury to their spinal cord. And most often than not, this injury is usually not reversible and has long-standing effects with respect to their quality of life. So please do remember this. whenever you're dealing with trauma in any setting whatsoever. And as Sir already mentioned, mechanism of injury plays a very key role. So whenever we're dealing with trauma, there are a few things that we assess. We understand how the patient is doing, what their physiology is, any obvious anatomical injuries that we can see. And the last bit is looking at the mechanism of injury. And based on this, we can decide how best to actually intervene and deal with this patient. So what we tend to do at Star Hospitals is, depending on these criteria, which is the anatomical, physiological, as well as the mechanical criteria, we decide if this patient needs something called a trauma call. And if we think a trauma call is appropriate, we basically get the entire team alert and ready. So we call the neurosurgeons down, we call the GI surgeons down, we call the orthopedic team down, and they're ready to meet the patient even before the patient gets here. And we do something called a multidisciplinary team primary assessment of the patient to deal with such complex trauma cases. In the meantime, let's talk more about the pre-hospital bit. So particularly whenever we're dealing with such trauma in the pre-hospital setting, as I've already mentioned, what you do makes a phenomenal difference. And once we are able to deploy the ambulance with the right kind of expertise, all of our ambulances has emergency medicine technicians who are able to deal with this patient in a certain order. So they first deal with the airway to make sure that the airway is open and the patient's able to move air through their mouth and their nose. The second thing is we make sure that they're breathing appropriately. Then we go on to something called circulation, C. So that is where we check their pulse and their blood pressure. And if they need anything or need any interventions or fluids there, we would administer it. If you're able to give blood, we would do that. And then we would continue on with your examination. It is particularly important that we do this as soon as feasible. That is where the concept of golden hour comes in. So as long as you're able to maintain the normal physiology of this patient early on, it makes a phenomenal difference. And as Sir said, it is not just limited to head injury or spinal injury. In fact, it has long-standing consequences across the entire body. So the concept of golden hour, addressing these physiological needs early in trauma, makes a phenomenal difference with your outcomes. And earlier you do it, the better it is. And if that is the case, we should do it pre-hospital. And that is exactly what we try to focus on doing. We try to start the treatment at the site of the accident rather than waiting for the patient to come to the hospital. And that's why pre-hospital emergency medicine is very crucial with your outcomes. Do you agree?
I definitely agree with you, Dr. Rahul, because for us, time is brain.
Yes.
That's very important to understand, because with every minute lost or every second lost, there can be like millions of nerves which are permanently damaged. And most of the times, if you're able to diagnose the issue like a head injury, bleed in the brain, or a spine injury, early intervention for us definitely helps in saving the whatever is the damage which is happening. For us to stop the further damage, that will help us in saving lives,
Yes.
reducing the morbidity and the mortality. Definitely, that's very important for us. Golden time is brain for us. Yeah,
Absolutely, because most of these injuries are usually not reversible, and that's the reason why the sooner you act on it, the better it is.
Yes.
Whatever injuries already occurred, we may not be able to do much, but there is always tissue that is salvageable. And salvaging this tissue has a phenomenal difference with respect to their outcomes and their quality of life. And this is what we try to focus on. So as a part of the initial assessment, while we are correcting the A for airway, B for breathing, C for circulation, moving on to disability and exposure, while we're doing this, we would do critical interventions to make sure there's appropriate blood supply to all of the organs in the body, particularly focusing on the brain as well as the heart. And that is why it is absolutely crucial we need to address this early and do this as a matter of preference more than anything else. So we have to do this soon and we have to do this right, which is why what we do is we do the initial assessment, we treat life-threatening injuries, and immediately after that, we get appropriate imaging to make sure we understand exactly what the injury profile is. And usually for complex trauma patients, that may involve doing a scan of the entire body. So what we do there is do a contrast enhanced CT of the entire body, covering the head, the entirety of the spine, the chest, the abdomen, and pelvis to identify any injuries and then act on it accordingly. If it's not a very complex trauma patient, and if we know that the injury is actually limited to the head or maybe suspecting the spine, then based on very specific criteria that is defined by the NICE guidelines, which is the guidelines we tend to use in this hospital, we try to identify which patients would need what kind of imaging, and we again try to do this as soon as feasible. Our guidelines are we need to do this imaging within 1 hour of presentations, but most often than not, we tend to do it within 30 minutes, as long as there's no challenges to do the same. And that is particularly important in identifying these injuries early and making sure there is no long-standing consequences of such injuries. Particularly focusing on a few neurosurgical trauma, let's talk about having a bleed in the brain. What is normally done then, and why is it so important that we need to do this early?
Again, for us here, the mechanism of injury is very important because most of the times, as we were discussing earlier, I told that if the patient has loss of consciousness,
Yes.
if the patient is thrown a fit, if he is like vomiting, or
Yes.
there is bleeding from the nose, ear, or the mouth,
Yes.
then it becomes very significant.
Yes.
There are also instances where the patient has a head injury, he gets up, he walks home,
Yes.
later on they may become unconscious.
Yes.
So until otherwise proved,
Yes.
it is always safe that when there is a head injury, it is always safe that we at least come to know what exactly is happening with the brain. Just
Yes.
because the patient is conscious does not mean nothing is happening. Because
Yes.
the brain is a contained cavity.
Yes.
It's a closed space.
Yes.
So if there is a small amount of bleed, the
Yes.
patient might be absolutely fine.
Yes.
But if the patient has sustained an injury, though the criteria say he is cleared with a head injury, there might not be anything. It is always safe for us. For suppose a child is playing and he's fallen down, he has sustained a head injury.
Yes.
We presume that it's fine. Most of the times it is true.
Yes.
But sometimes there can be a bleed in the brain, and as long as the brain is compensating for those bleeds,
Yes.
they tend to be normal.
Yes.
But in those scenarios, what we prefer to do is clinical assessment is definitely important, followed by if the mechanism of injury is quite significant, then it is better to get a CT scan done, which is probably the best way of initial assessment of the patient.
Yes.
And if there is a bleed in the brain, we need to, like, if the bleeds are small, the patient is conscious. Most of the times I tell my patients, if the patient is conscious, if he's not throwing a fit, even if he's talking nonsense, we are okay with it. Because as long as the brain is compensating, even if there is a bleed, we need not act in an emergency. But there are instances where there can be big bleeds in the brain and the patient is still fine. But we should not be carried away by the saying that patient is fine, so should we do or not? Because there is a sort of bleed called extradural hematoma, where the patient might have a very large bleed in the brain. The other day there was a child who had come to us. The child was playing and there was the TV had fallen on her head. That was a 4-year-old child. The child was absolutely fine. But when the mechanism of injury, as in this case, it was very significant. The fall of a big object like a television on the head is quite significant history. So in those situations, we have asked for a CT scan, which was showing a quite big extradural hematoma. That's a big bleed in the brain, but the child was fine. No, it was very difficult for us convincing the parents that this is a big bleed, we need to get rid of it, we need to act immediately, we need to operate. Well, the parents were of the discussion, the child is fine, why do you want to operate? That is a challenge for all of us, because as long as the child or the patient or the physiology is such that the mechanism is such that they are compensating for the extra amount of bleed or thing which is occupying the brain cranial cavity, the patient is absolutely fine. But in such situations, if I still say the patient is fine, I don't want to operate, it becomes miserable. The patient might decompensate and they might sink into coma. So in those situations, what we did was we were lucky enough to make them understand, show the images that this is the problem, make them understand. And they were of the opinion that should we wait for some time? I said, no boss, no waiting, better get rid of the bleed. And then they got convinced and we could operate on the child. and in 2 days the child is fine. We could able to discharge the child. So
Yes.
sometimes it's also a challenge for us to make the patients understand that you have a problem and they need to get rid of it.
Yes.
So there can be instances where there are large bleeds and the patient is unconscious, and most of the times some unwitnessed falls or the attendants are not available. In those
Yes.
scenarios, it becomes difficult for a doctor to take a decision, for the hospital for that matter to take a decision whether to operate or not.
Yes.
Most of the times, whoever is the nearest person available, we generally tend to explain them, and probably if the patient needs some surgery or some intervention, it is always better that though the nearest kith and kin are not available, better make them understand, take the risk and get rid of the bleed and try to salvage the brain as much as possible. That's probably the better way of managing it.
I think that's very appropriate. I think what we're trying to focus here is not to be dismissive of the injury. Particularly anytime you're dealing with any head injury or any injury along the spine too. If there's any hint of any symptoms at all, and if the mechanism particularly is something that is troublesome, always err on the side of caution. Get the child to a hospital so that the doctors can examine and review the child and identify particularly these ones who may appear well initially, but who can deteriorate quite rapidly. That can happen a lot with pediatric patients, and that can also happen a lot with elderly patients. So these are significant patient populations who may present initially as being fine, but may have issues and may actually have a silent bleed that needs to be addressed immediately. So always err on the side of caution. And whenever you're suspecting any head injury, please make sure you get the patient to the hospital so the doctors can have a look and then intervene appropriately. That's a very important point that you made, particularly in these two populations. It is quite challenging to identify such patients immediately. But addressing this bleed and evacuating this bleed will make a phenomenal difference as far as the brain health is concerned.
True.
And this is mainly to make sure that there is good circulation within the brain and that you're preventing any further injury. And that is primarily what we are focused on, what we're trying to address. And that's exactly why Sir earlier mentioned that time is brain. The sooner we address it, the better it is for any long-standing consequences of such injuries. Let's talk about spinal injuries too. Why is spinal injuries significant, and what are the consequences of spinal injuries?
Yeah, most of the times, because what happens is, again, the mechanism of trauma, where the injury is, that's also important. Because see, for suppose there is a cervical cord injury, there's a cervical spine injury, the muscles related to breathing are also coming from there.
Yes.
So if there is an injury to the breathing related muscles, apart as the limbs are not function, they might not function. So if we are like the injury itself has caused a damage, or there is a fracture but it's stable, but while mobilizing, if the fracture is unstable, it moves and causes some injury to the spinal cord, that might lead to a very bad, probably irreparable injury. So that's why it's very important that if the patient is conscious, still it is always safe that we need to stabilize the spine and shift the patient as a log. So the entire spine needs to be considered, because even if it's a thoracic injury or a lumbar injury, the patient might have some deficit, but it might not be life-threatening. Whereas the cervical spine, it's very important that we understand that the patient, we might lose the patient because there is a injury to the cord, high cord injuries especially, that can lead to diaphragmatic palsy and weakness of the muscles of breathing also. So that becomes a very big challenge for us. So it is important that whether already the deficit has settled or there is a fracture, it's stable. So how we should be shifting the patient. Once the patient is in the hospital, probably we'll have to give, as we are doing the ABCD, we also need to assess how the spine is, how the motor functioning is, and if there is a deficit for sure, then definitely we need to assess the patient. Or if there are signs like we tend to like palpate the spine, or if the patient is conscious, most of the times the patient would be giving us the complaint that he has a pain in the neck or in the back. So in those scenarios, it is always good that we get an investigation done, give clearance. See, if it is a soft tissue injury, we are still okay with it. But
Yes.
if there is a spine injury, that to an unstable fracture, it's very important that we address it at the earliest, because as it is for the brain, it is for the spine, because it's all
Yes.
the same system. It's all part of
Yes.
the same system. So once there is an unstable fracture, it has caused some damage to the spinal cord.
Yes.
We might not be able to salvage these cords. So what we can do is,
Yes.
if we are picking up an unstable fracture, the patient has already developed the deficits, better stabilize the spine, decompress the spine, relieve these factors which are causing the pressure on the spine, so that whatever is the recovery which can happen, that will happen over a period of time. The first idea is to see that no further damage is happening. The
Yes.
second point is to see that whatever is the trauma which is caused, remove that, decompress it, and so that the nerve tissue will, there will be a chance for the nerve tissue to recover, because many a times
Yes.
once damaged, they are irreversible.
Yes.
The damage is irreversible. We might not be able to salvage the tissue. So
Yes.
that's where it is important. So in those scenarios, what we tell is do an early surgery if required, wherever
Yes.
it's an unstable fracture, because not all
Yes.
fractures will need surgery or
Yes.
something,
Yes.
or some procedure to be done. Most of the times, if it is an unstable fracture, better go for a surgery, decompress the spine, and
Yes.
see that the patient would recover. Probably, even if there is a damage, we can expect recovery over a period of 6 months to 1 year, something like that.
Okay.
Yeah.
Okay.
By fixing the spine. Even if the patient, for suppose there can be scenarios where there is a cervical spine injury or a thoracic injury and the patient is paraplegic.
Yes.
And then in those scenarios, even if we are like the patient doesn't want to get operated, that's a big problem. Making them understand that it's important that even if the patient may not recover, it is important that we fix the spine so that the disability can be prevented. We can at least make the patient sit in a wheelchair. That is very important for us in terms of rehabilitation programs which we generally plan for those
Yes.
patients. So it is very important to understand that whether there is a fracture, if there is a fracture, is it a stable fracture or unstable fracture? Is there any deficit? All these things help us in deciding what is the way of management we are going to progress with.
That's a very important point that is made. I think we've reiterated this prior to this too, but it is a very important point nonetheless. Because as Sir said, whatever initial injury occurs, or the primary injury as we call it, is usually irreversible. And which is the reason why every single time we encounter such trauma patient, we take utmost care in immobilizing them. Because what we do not want to do is that there is a fracture, the spinal cord is actually intact, but as a consequence of our movement, which is not controlled, we can actually end up causing significant injury. So which is why we were always focusing on the three important steps: immobilization, control bleeding, and call for help. This is the reason why we focus on it, because it has implications, particularly when it comes to both head injury and especially spinal injury. Immobilization is the key. So if we start with that from your end, then the outcome of these patients can actually improve dramatically. So we immobilize the cervical spine using a collar. We can also use blocks to immobilize the cervical spine while we place this patient on something called a spine board, which is a long orange board that is present, and we strap the patient onto this board. So we do this at the site of the injury itself, move the patient in the ambulance safely, get them to the emergency room, which is where we do the primary survey. We do a quick assessment of the entire patient to make sure we are dealing with any life-threatening injuries. And also while doing this, we check if there's any neurological deficits that are obvious. As always said, based on the mechanism, if it is a significant fall from a height, if it's a high velocity injury, if there's any penetrating trauma. So depending on the mechanism, and we suspect that there is a possibility that the spine could be injured, we always proceed assuming that it exists. We proceed assuming that the spinal injury is there until it is proven otherwise by clinical findings as well as radiological findings. And that is why this step is so crucial to address such complex trauma patients. Thank you for sharing that, and particularly the importance of immobilization is really the key when we're dealing with such spinal trauma
That's very
patients.
important. Yeah.
when this trauma does occur, and unfortunately there are circumstances when this injury has already occurred when the accident happened itself. So can you talk to us more about how we deal with such patients? What is rehabilitation there? What is the importance of this process?
For suppose, again, the same thing, like if the patient has sustained a head injury, and whether we have to operate him or not operate on him, that's depending on the scenario. Many a times there can be issues where the patient is unconscious for a very long time. It becomes very important for us to understand that whatever is the mechanism of injury, whether it is to the brain, or whether it is to the spine, the neurological tissue will take a very long time. See, if the skin gets injured, it probably heals in like 1 week, 10 days.
Yes.
If there is a bone injury, it probably heals over a period of 2 months. If there is a neurological injury, it might take, in the worst possible scenario, 6 months to 1 year. So it is very important for us to understand, point number one, we need to prevent an accident if it is preventable.
Yes.
Address the problem, address the issue at the earliest. Like if there is a brain injury, he needs to be operated. Get rid of it at the earliest. Spine injury, if there is an unstable fracture, fix the spine. So that whatever is the extent of damage which has happened due to that is the primary injury which has happened due to the injury as such, that unfortunately is not in our hands.
Yes.
What we can do is to see that there is no secondary injury to the neurological structures which can be the cause for the disability or the mortality of the patient. So it is very important for us to understand that time is brain, whether time is spine also for that matter.
Absolutely.
So we need to address the issue fast, and then whatever is the thing, we need to stabilize the patient, we need to get rid of the trauma causing thing or whatever is the bleed or the unstable fracture. Again, for suppose if it's a fracture of the spine, there is a injury, there is a paraplegia, there is a weakness of the limbs. So what we do is we decompress the spine, fix the spine, so that what we can do is we can make the patient get out of the bed at the earliest, so that we can prevent the further complications from happening. That is more important, I presume. Because once the patient is paraplegic or quadriplegic for that matter, he will be bedridden. So what happens is, lying down on the bed, the patient tends to develop certain other new complications like lung-related issues, gut-related issues, urinary tract-related issues, bed sore-related issues. All these things would add to the burden of the disease process. So what we emphasize is fix the spine, decompress the spine, and try to make the patient at least wheelchair bound at the earliest. Start off with the physio immediately, so that whatever is the associated complications which can happen, we can prevent all those complications. So for suppose the patient ends up with a pneumonia lying down on the bed, that's a big challenge. That is adding to his disease burden. Again, if there is a bed sore, patient where the fracture is not stabilized, for some reason we were not able to stabilize the spine, we cannot turn the patient, we cannot make them sit. So what happens is, lying down on the bed, they tend to develop some bed sore or something like that. All these things add to the complications or the disease burden of the patient. So we should understand that early prevention, early intervention, and also disability and further complication prevention is also very important, especially in management of the brain and spine related issues, because the recovery part is prolonged. It's very, it takes a lot of time for them to recover. So all these things need to be, we need to make them understand, we need to make the family understand, and we should make them part of the treatment, because I always emphasize on this point, because they need to understand, and they have to understand that we might have to live this disability probably for a very long time and probably for rest of our lives. So that's a very important point we need to make them understand. And most of the times we are happy that for us it's a challenge, because saving the patient's life is very important for us, and preventing the disability to the extent possible is again very important for us. So rehabilitation, mobilizing the patient, rehabilitation, all these things are very important part of our management. And my point is, from the day one, we try to make them understand what are all the scenarios which can happen. That's how I try to explain them that this might be a long course of action, and we might have, there might be some disabilities. So these might be permanent features also. So
Yes.
unfortunately, saving life is important. So that we have to emphasize on. And whatever is the disability, for suppose the patient is lost his speech, or a patient is his half of the body is not functioning, we can expect recovery to happen. But for that to be happening, we need to intervene early, and we need to see that whatever is the problem which is causing the deficit, we need to address that at the earliest, so that the patient recovery would be in a better way.
Yes.
That's very important, I believe. So I always emphasize on uh, make them understand all the possibilities, all the scenarios, how this is going to go. We are going to deal with it, and make them part of the treatment. That's how
Yes.
I take it forward. Yeah, that's how
Yes.
it is.
Okay, because that's true. Because most often than not, this needs to be very holistic when you're approaching this. Uh, this is something that does take a lot of time, which
Definitely.
means it takes a toll on not just the patient, but even the caregivers. It is important to understand what the actual injury profile is, which part of this is long standing. And what I mean by that is which of this is not reversible, and what are the different things you need to do to prevent any additional complications which can have again an influence on your quality of life. And that is a big focus of what tends to happen after the injury has actually occurred. Mobilizing these patients early, making sure that there's no bed sores, making sure that they have no added infections. All of this has a significant impact on your quality of life, and that is usually what we tend to focus when it comes to the long-term consequences once we have actually dealt with the injury. And that is very important that we need to address this. And this is usually always a team game, both in the hospital as well as home. Home because we need the support of caregivers as well as the patient, and hospital again because it's usually a big team that is normally involved in their care, which can involve the team with the medicine team when it comes to any infections that they may have, the neurosurgical team, the physiotherapy team. So all of these teams tend to get involved when it comes to the long-term consequences of this injury profile.
I think that is very important. They need to understand the importance of golden hour, and again, adding to that, time is brain. So that's very important. And most of the times, these patients need lot of time, because for suppose there is a head injury and the patient is unconscious, the most common question, whatever we try to explain, because of their anxiety or the patient's condition is such that they most of the times initially the patient attenders or the family members are not able to understand what exactly are they dealing with. We understanding the problem is one thing, making them understanding is more important,
Of course.
and taking them along in the part of our treatment is more important for us, because until and unless they understand that we are not gods, and we are like people who are trying to do things scientifically in a methodical way, and we trying to understand that, making them understand that this might be a prolonged course, and whatever is the disability or the deficit that the patient has, it might be a permanent feature. And unfortunately, even till date, it is we don't know how exactly the neurological tissue is going to behave, or the brain or spine for that matter is going to behave. And nobody is sure that this particular treatment or this particular surgery or this particular medicine is going to cure them of those disabilities. So till the further advances are made, as on today, there might be deficits or there might be disabilities. Our intention is to see that save the patient's life first, in order to see that whatever is the disability or deficit which is present, it should recover over a period of time. That's what we emphasize on.
Okay, that's very appropriate. Thank you. Thank you. I think that's exactly what we're hoping to focus on with our talk today. Just to summarize very quickly, I think prevention is always the key. Particularly if you're traveling on two-wheelers, please wear a helmet. If you're traveling in a car, make sure you wear a seatbelt. If you have any occupational hazards, what I mean by that is if you're working in construction or any industrial areas, make sure you wear a hard helmet. So all of this makes a phenomenal difference. Whenever you spot anyone who's had trauma, irrespective of what you perceive the injury profile may be, always assume that their neck or their spine may have an injury. So, as we had already mentioned, step 1 is immobilize the patient, step 2, control bleeding, and step 3 is call for help. When you call for help, emergency medicine technicians or senior nurses will be deployed in the ambulances coming to you. And once they come and see the patient, what they would end up doing is do a quick ABCDE assessment. So they cover the airway, breathing, circulation, disability, and exposure. So they do an assessment in a methodical fashion. They address any and all injuries that are life-threatening immediately, and this always needs to happen early, which is why I believe it needs to happen at the site of the accident rather than waiting for the patient to come to the hospital. At this point of time, again, depending on the mechanism, we might put a cervical collar to stabilize the spine, adding blocks to it, and place the patient on a spinal board and transfer this patient in the back of an ambulance. Once they come to us in the hospital, most often than not, if it's a trauma call, we involve the neurosurgeons, we involve the orthopedic team, the GI surgeons, all of them would be present in the hospital even before the patient comes there. At this point, we do a repeat primary survey. We identify all life-threatening injuries and address it immediately. We have a low threshold to scan these patients. And whenever we suspect such complex injury, we do a CT scan of these patients, usually with contrast, to identify these injuries. And once we understand exactly what the trauma profile is, we would make appropriate interventions. And as Sir had mentioned this, time is brain here. The quicker we do all of these steps, the better it is. And ideally, we do this in the first 1 hour. Early interventions to remove any significant bleeds in the brain, decompression of any spinal injuries, addressing any unstable spinal injuries is the key to prevent any further injury to the spine. We may not be able to address the primary injury that has occurred as a consequence of the accident, but there is a lot that we can do to address any secondary injuries that could occur if improper care is delivered. And that is usually the focus of everything that we are trying to do here. Once we have done this, then any injuries that are already present and any symptoms that these patients may have may usually be long-standing. And this is where teamwork is the key. We need to work with the caregivers as well as the patient to give them very realistic idea of exactly what they are dealing with. And anything that we do at this point of time, it's a long-term game. So we need to make sure that there is no further insults to this very fragile physiology that this patient has, prevent any further infections, prevent any bed sores, and make every effort that we can to make sure that their quality of life is good. This is a brief summary of everything that we have talked about. So while you're on the road, please stay safe. And in case you have any such emergencies, always remember to call for help. And our number is 9071 104 108.